Did you know that more than 145,000 people are diagnosed with colorectal cancer each year, making it the third leading cancer killer amongst men and women? Colorectal cancer is a cancer that develops in the colon or rectum. Although family history is an important factor in colon cancer risk, it is not the only factor. Other factors include high-fat diet or the presence of polyps in the large intestine. There are many symptoms of colon cancer, some of which include rectal pain or bleeding, change in bowel habits, or abdominal pain. However, these symptoms do not always develop for several years. The good news is that with early detection, colon cancer can be stopped. A colonoscopy is a procedure which allows a physician to look at the interior lining of the large intestine through a high-resolution video camera called an endoscope. This procedure is most often used to look for early signs of cancer in the colon and/or rectum. An endoscope is an instrument which contains a camera and a light which will help the physician visualize the inside of your colon, or esophagus, stomach, or duodenum. He will be looking for polyps, colon disease, ulcers, areas of inflammation or bleeding, and causes of diarrhea. The procedure will usually take an average of 30 to 45 minutes, and recovery times may vary between 2 to 3 hours. How are you doing, Shannon?
So good.
Good. Do you have any memory of doing that procedure? Okay, good. That's what we like to hear. We had a couple of small polyps. Took those out and they're gone. We'll send them off to pathology. You should have an answer back on what those show within just a few days. What that'll tell us is how soon we ought to think about doing another colonoscopy with you. You'll always get a phone call from us to let you know the results.
Okay.
Now for the rest of the day, you're just supposed to take it easy. Go home, put your feet up. No driving for 24 hours.
All right.
Any questions I can answer for you?
No, that's it.
Okay, sir. Well, take it easy today, okay?
Thank you.
You bet. So remember, the average age for a person with no family history to have a colonoscopy is 50, and the procedure should be repeated every 10 years. If you're a high-risk patient with family history, inflammatory bowel disease, of African American descent, or have a genetic colon polyp condition, you should screen earlier and more frequently. A colonoscopy is an easy procedure that is diagnostic and potentially therapeutic.